Good evening, folks. This is take two on the topic men face double the health risks. 9 critical conditions affecting males more than women refers to a video segment highlighting a troubling disparity in male health outcomes based on the surrounding page content. The key message is that men are developing certain life threatening conditions such as cancer and kidney stones at significantly higher rates than women. This isn't just about biology, it's about it's also tied to behavioral patterns. Okay. Key insights from the page. Healthcare avoidance. Data from the Cleveland Clinic underscores a disturbing trend. Many men delay or avoid seeking medical care, which contributes to worse outcomes and higher mortality rates. Conditions mentioned. While the video doesn't list all 9 conditions explicitly in the surrounding text, it emphasizes cancer and kidney stones as examples. Other sources suggest that conditions like cardiovascular disease, prostate cancer, gout, aortic aneurysm, and melanoma are also more prevalent or severe in men. Underlying factors: lifestyle choices, e.g., smoking, poor diet, alcohol use, biological predispositions, hormonal differences, genetic risks, social norms that discourage men from prioritizing preventative care. Why it matters. This framing isn't just about listing diseases, it's a call to action. The video and page content aim to raise awareness about gender health disparities and encourage men to take proactive steps toward prevention and early detection and regular checkups. Folks, this is a real problem for guys in the US. It's a real problem. Men need to men need to start taking more proactive initiative for their health. Okay. And then we've got, if you'd like, I can break down each of the 9 conditions with comparatives, stats, and culturally responsive intervention strategies. Want to co-design a myth-busting resource or outreach toolkit around this? Based on surrounding page and video content, the 9 critical conditions that disproportionately affect men compared to women include cancer. Men are more likely to develop and die from many types of cancer, including lung, liver, and bladder cancers. Kidney stones. Men experience kidney stones at nearly double the rate of women due to dietary and hydration habits. Aortic aneurysm. Men are at greater risk of this life threatening vascular condition. Melanoma. Men have higher rates of skin cancer and worse outcomes, possibly due to lower sunscreen use and delayed detection. Liver disease. Conditions like cirrhosis and hepatitis related complications are more prevalent in men, often linked to alcohol use. Suicide and mental health disorders. Men are less likely to seek help and more likely to die by suicide despite lower reported rates of depression. These disparities are shaped by a mix of biological, behavioral, and social factors. Including healthcare avoidance, cultural norms around masculinity, and underutilization of preventative care. Would you like to co create a myth busting guide or outreach toolkit tailored to engaging men in proactive health behaviors? We could even adapt it for rural and culturally specific contexts. Here's a detailed breakdown of the 9 critical health conditions and disproportionately affect men, along with contributing factors and implications for outreach or intervention strategies. Number 1, cancer. Higher risk. Men are more likely to develop and die from cancers such as lung, liver, bladder, and colorectal. Why? Greater exposure to carcinogens, and e.g., smoking, occupational hazards, lower screening rates, and delayed diagnosis. Intervention ideas. Culturally tailored screening campaigns, myth busting around masculinity and vulnerability, and workplace based outreach. Kidney stones. High risk. Men experience kidney stones nearly twice as often as women. Why? Diets high in protein and salts lower fluid intake and metabolic differences. Intervention ideas, hydration challenges, dietary education, and rural outreach with mobile clinics. Cardiovascular disease, higher risk. Men suffer heart attacks and strokes more frequently and at a younger ages. Testosterone linked lipid testosterone linked lipid profiles, higher rates of hypertension, and lifestyle factors like smoking and stress. Intervention ideas, barbershop based blood pressure checks, culturally responsive heart health toolkits, and peer led prevention programs. Prostate cancer. Male specific. One of the most common cancers in men, especially over 50. Age, genetics, and race. Higher rates of in black men. Intervention ideas, community forums, on screening, myth, on screening myths, faith based outreach and decision making, and discussion ads for PSAs, testing, gout, higher risk. Men are more prone due to elevated uric acid levels and dietary patterns, red meat, alcohol, and sugary drinks. Estrogen may protect women premenopause. Intervention ideas, nutrition workshops, culturally adapted meal planning, and myth busting around rich man's disease. Aortic aneurysm, higher risk. Men are more likely to develop abdominal aortic aneurysms. Why? Smoking history, hypertension, and genetic predisposition. Intervention ideas, ultrasound screening for men over 65, especially in rural areas. Integration into veteran health programs. 7. Melanoma. Higher risk. Men have higher rates and worse outcomes. Why? Less sunscreen use, outdoor work, exposure, and delayed detection. Intervention ideas, skin checks at job sites, culturally responsive, culturally resonant sun safety campaigns, and mobile dermatology units. 8 is liver disease. Higher risk. Men are more likely affected by cryosis, hepatitis complications, and alcohol related liver damage. Why higher alcohol consumption, uh, viral exposure, and more metabolic factors. Intervention ideas: harm reduction, outreach, hepatitis screening, and high risk areas. Or high risk communities, and alcohol use myth busting. Suicide and mental health disorders. Higher risk. Men die by suicide at significantly higher rates despite lower reported depression. Under underdiagnosis, stigma, and uh, reduced reluctance to seek help. Intervention ideas: peer led supports, groups, culturally adapted mental health literacy, and digital outreach tailored to male audiences. Would you like to co-create a participatory toolkit or outreach framework that integrates these insights? We could tailor it for caregivers of rural health workers, or even intergenerational community programs. Let's see. Condition summary brief. Men are more likely to develop and die from cancers like lung, liver, and bladder. Kidney stones occur nearly twice as often in men, often linked to diet and hydration habits. Cardiovascular disease. Men face earlier and more frequent heart attacks and strokes. Prostate cancer, a common male specific cancer, especially in older men. Gout more prevalent in men due to higher uric acid levels and dietary patterns. Aortic aneurysm. Men are more men are at more great men are at greater risk for this potentially fatal vascular condition. Melanoma, higher rates and worse outcomes in men, often due to delayed detection. Liver disease, more common in men, often tied to alcohol use and hepatitis complications. Suicide and mental health. Men are less likely to seek help and more likely to die by suicide. These discrepancies are shaped by a mix of biological, behavioral, and social factors, including healthcare avoidance and cultural norms around masculinity. Would you like to build a community facing resource or virtual dashboard that maps these risks alongside culturally responsive interventions? We could tailor it for caregivers, rural health workers, or intergenerational programs. Improving healthcare outreach for women requires more than just increasing access to. Okay, guys, so that is it for tonight. I will see everybody for shows tomorrow. If I feel up to it, maybe I'll jump back on later for shows. For now, Gator Wellness, take care, folks.